So, hello everyone. My name is Amber,
My name is Constance.
My name is Emma.
and we're here to talk to you about hypertension management in the ambulatory care setting. So, here are some learning objectives. So, by the end of this presentation, the successful learner will be able to define hypertension and describe blood pressure goals, list the complications of hypertension, list key non-drug therapy for controlling hypertension, and understand the role of the ambulatory care pharmacist in hypertension management. So just to go over the definition of hypertension, the American Heart Association defines hypertension or high blood pressure um, when your blood pressure, the force of your blood pushing against the walls of your blood vessels, is consistently too high. So there are four different categories. We have normal, elevated, stage 1, and stage 2, as you can see on the image to the right. And then to define systolic blood pressure, this is the pressure that your blood exerts against your artery walls when your heart is beating. And diastolic blood pressure is the pressure your blood exerts against your artery walls when your heart is at rest. And you can see the goal targets for blood pressure in the columns in the picture on the right.
As you can see here, we have some example statistics for hypertension, including the fact that high blood pressure contributes to nearly 1,000 deaths a day. Nearly half of adults in the United States, around 47%, or 116 million have hypertension, and an estimated 46% of adults with hypertension are in fact unaware that they have this condition.
So some complications of uncontrolled hypertension includes heart attack, stroke, heart failure, kidney disease or failure, vision loss, sexual dysfunction, angina, or peripheral artery disease. However, hypertension is also known as a silent killer, so you might not experience any of these, but this is as symptoms, but this is what consistent high blood pressure can lead to.
So in terms of risk factors and symptoms, for symptoms, typically no symptoms that would indicate if an individual had hypertension. High blood pressure is largely symptomless, also known as a silent killer. Some risk factors, on the other hand, are like diabetes, unhealthy diet, physical inactivity, obesity, stress, sleep apnea, high cholesterol, excess alcohol use, and tobacco use. In fact, 6 out of 10 people who have diabetes also have high blood pressure. For non-drug management of hypertension, it is recommended that you get at least 150 minutes of moderate intensity aerobic physical activity or 75 minutes of vigorous intensity physical activity or an equivalent combination each week. For stress, you can try meditation, acupuncture, finding and avoiding stress triggers. Excess alcohol consumption is also a trigger, so women should have no more than 1 drink a day, and men should have no more than 2 drinks a day. Tobacco use is also a trigger, so trying nicotine replacement therapy, such as patches or gum. An unhealthy diet, so a diet high in sodium and low in potassium puts you at risk for high blood pressure. So Mrs. Dash seasoning is a great alternative to salt. And again, diabetes is a risk factor, so eat healthy diet and exercise regularly. And here is just a chart form recommendation from the American College of Cardiology that shows these same risk factors and what you can do to modulate them and how these can positively affect hypertension.
So how do you properly get your blood pressure checked? So before you get your blood pressure taken, you should not be smoking, have any caffeine, or exercise 30 minutes prior. It is also important to note that you should probably empty your bladder before taking your blood pressure and sit still for like 5 minutes. During the blood pressure, make sure you're not talking and make sure the cuff is the right size in the right place. Keep your cupped arm on a flat surface and at heart level. You should also be sitting upright, back straight, and feet flat on the floor. So your feet should not be dangling. After, you want to wait like 1 minute and retake your blood pressure, average the readings, and make sure to keep a log and bring it to every checkup. And bring your device yearly to make sure it is accurate. So some common medications used to treat hypertension. One of the most common drugs is ACE inhibitors. These drugs are known as the prodrugs. So this will be like your lisinopril. The purpose is to block angiotensin, and that is a chemical that narrows blood vessels. However, there's some common side effects include like a dry hacking cough, muscle pain, and a rash. You should not be taking these drugs if you're pregnant. The next set of drugs is your diuretics. Common examples include hydrochlorothiazide or chlorothalidone. The purpose is to remove extra salt or water to decrease the pressure pushing against the blood vessels. However, some side effects of this would be like excessive urination, muscle pains, and headaches. It is best to take it in the morning so you don't have to wake up at night to go to the bathroom. Another drugs would be calcium channel blockers. These would be the dopamine drugs and verapamil and diltiazem. One of the common dopamine drugs would be like amlodipine. The purpose is to block calcium to relax and open those blood vessels so blood can like flow through. Side effects include headaches, constipation, nausea, and a lower ankle swelling, often the drug of choice in treating the high blood pressure in African Americans.
So, ambulatory care pharmacists can have a huge role in the management of hypertension, and here are just highlights of a few of the ways that they can make a huge impact in the management for the patients. So, pharmacists are specifically trained to counsel and provide education to patients, which helps improve understanding and adherence to medications. They're also trained to choose the medication that's best for you based on patient-specific factors such as other disease states, medications, age, or race. Um, they can also recommend non-drug management strategies like Emma was talking about, so salt alternatives like the DASH diet and exercise regimens. And pharmacists can identify non or causes of non-adherence and barriers to patient care, so we can address these with patients and help them overcome these barriers. Um, and we can also check for complications of uncontrolled elevated hypertension, such as headaches and problems with seeing that can develop. And lastly, there has been a recent improvement in the use of telehealth to deliver patient care ever since the pandemic, and this has increased access to care for a ton of patients. So thank you for listening to our presentation. Attached are our references, and you can reach out to us if you have any questions. Thank you.